back here in the final segment of our program today as we continue our health series sponsored by NIGAD International. And it's wonderful that we are educating people on chronic non-communicable diseases. And we have Latoya Patterson and Nakara Patterson. Now, I ain't going to burst the bubble because they told me that they don't want people to know that they are twins, but people can see that they're twins, right? So it's good to have these twins on today, right? And they are both working in the Department of Public Health, and they are health educators. Why you chose to be health educators, you twins?
I think it's important that people have the information necessary to have the information to prevent getting chronic conditions like diabetes, hypertension, and also those who are already diagnosed with these conditions can have information as to what they can do to manage these conditions so that they prevent further complications. I think that people need to be informed and educated so that they can know what they need to do to prevent getting worse from the conditions that they already have.
And that is the role of the Department of Public Health?
Yes, it is.
So tell us what you do on an ongoing basis.
So what I do at the clinic, I provide information to patients, either one-on-one or by doing health talks. So a patient who's, especially newly diagnosed patients with hypertension, diabetes, or other chronic conditions would get referred to our CNCD department. And as a health educator, my role is to help them to manage these conditions, walk them along so that they'll know how to eat, how important exercise is, explain the condition to them, and explain the complications so that they won't get that far in their condition.
And so you monitor people who are in these conditions?
Yes, I assist with that.
Okay. And I am told that there are a growing number of people who are on dialysis in this country because they have allowed themselves to slip into a stage or the stage of kidney failure.
Absolutely, and kidney failure is one of the, it's obviously one of the worst things that can happen to a person with these conditions, in addition to, of course, amputation, blindness. But if we reach out to people and let them know the information, you can change your eating habits. It's not difficult to change from an unhealthy diet to a healthy diet. And we are there to help guide these people along so that you don't get to the point where you're on dialysis. And also, in addition to that, so when you think about health interventions to promote healthy lifestyles for people, you look at the individual, and then you look at the family, you look at the community, and then of course there's different organizations and policy levels. So there's different levels of intervention. And what we do is the one-on-one, we do families. Sometimes people bring their spouses or a child or a sister, brother, and sometimes we get involved with the community, so there's 3 different levels. But when you reach to the policy level, that means it makes it easier to get affordable, healthy foods, okay? Laws that increase taxes on smoking, on cigarettes, so that people won't be inclined to smoke so much. So different policies will help with that too, but there's different levels, and what we're focusing on is individual and of course community at our level.
Tell me about the consumption of alcohol and the impact of this on the chronic non-communicable diseases in the country.
I think people don't make the connection with smoking and drinking alcohol. Obviously, an excessive amount of alcohol. Yeah. People don't make that connection between drinking alcohol and their health, where there's diabetes, hypertension, and I think that the more educated people are, the more they will realize that these things affect their health. It affects the diabetes, it keeps your sugar level high, so that it's not managed, and it also affects your high blood pressure, your pressure. So drinking alcohol excessively, in addition to smoking, affects your blood pressure and it affects your blood sugar levels.
And you can drink alcohol in moderation.
In moderation.
Yes.
That's the issue. It's moderation, and then there's an excess. That's the issue that, I guess people need to learn where to draw the line. What is an excess? What is moderation?
And everything should be done in moderation.
In moderation, not smoking.
Not smoking.
Not smoking.
You shouldn't smoke at all.
No smoking.
Yes, absolutely.
No exception for that.
There's something called inflammation. And there are a whole lot of people who go through various and I don't know if it has to do with diabetes or hypertension, but they have arthritis, all kinds of pains and aches as a result of inflammation. You come across these things in your work
yes,
as well,
and
right?
That all of that has to do with what you eat and whether or not you exercise. And what we put in our bodies should be whole foods, so we should be eating from the ground, of course, fruits, vegetables, and whole grains. So a consumption of excess red meat, for instance, could affect people's your physiological functions and lead to arthritis and inflammation. But if we empower people to know what they should look for in the grocery stores, that they need to exercise has so many health benefits. It reduces stress, it can lower your cholesterol, it lowers blood sugar, and it also lowers blood pressure. And obviously it would help with flexibility and decrease the chances of having arthritis as well.
And there are some people who would tell you, well, I am hypertensive because I inherited this, or I have diabetes because, my father had it and my mother had it, and so I couldn't avoid it. Is that true?
Okay, so there is a genetic factor involved in this, but that's not correct to say you have hypertension or diabetes because this person in your family has it. It has a lot to do with your lifestyle. If you lead an unhealthy lifestyle where you don't exercise, where you're physically inactive, where you don't eat healthy foods, you smoke, you drink in excess, then you're more inclined to get these conditions. But if you're someone who takes care of your body, you exercise, you eat healthy foods, you have a lot of fruits and vegetables and fiber in your diet, you're less likely to get these conditions.
And so even though you have a genetic predisposition to these diseases, you can avoid them by what you consume.
Yes, absolutely. Your genetic predisposition increases your risk of getting these conditions, but it doesn't mean that you will get these chronic conditions. It just increases the risk of you possibly getting it.
Now, you talk about the chronic conditions. As we spoke to the other nurses earlier on, they talked about people who might have a particular disease and don't even know it.
Absolutely. So, like the nurse mentioned earlier with hypertension, we know it's the silent killer. So sometimes people have headaches and then they will go to the doctor because I have a really bad headache and it's not going away. And then they'll have their pressure tested and that's how they know. But diabetes has symptoms that you can look for. So there's symptoms of always thirsty. You always feel like you need a drink of water. You go to the bathroom excessively. Sometimes you just extremely hungry all of the time. You have tingling in your fingers, your feet, your toes. So those are some of the symptoms that you would get if you have diabetes.
When you say go to the bathroom excessively, what are you talking about?
Frequent urination. Frequent urination.
How many times a day?
A lot.
A lot?
Yes.
Yes. Well, what does that mean? 5, 6, 7?
So you may have to go to the bathroom several times during the night, and that's an indication.
What about once?
Once is fine.
Once is fine. Well, I'm fine.
Are you checking on yourself?
Once is fine.
I just wanted to know whether or not I'm fine,
Yes. Okay. And sometimes people with diabetes and some other symptoms could be they have sores that take a long time to heal, and also they are extremely hungry because their body's not using the energy. The insulin isn't doing its job in the body, so they don't have energy, so they're always tired and they feel extremely hungry. So that's just another symptom, some other symptoms. And also blurry vision. If sometimes, all of a sudden you start to have blurry vision, your sight isn't what it used to be, that might be a concern. You could see a doctor at that time.
But you don't need to have all of these symptoms together
to
determine that you do have diabetes.
No.
Any one of them.
Yes, sir.
Okay.
Or one or two, but it's not one, it's not just one that's an indication. But for someone who, say, for example, goes to the bathroom a lot during the night, even if they have just that one, then they know something's wrong. They can see a physician at that point.
Okay, and you would not necessarily be placed on medication.
The first thing a physician would normally do is encourage the patient with a lifestyle modification, changing your diet, exercising, and then sometimes they put them on medication as well at the same time. So I guess it depends on how the extent of their condition at that point. But lifestyle change is one of the first steps to take. It's the first line of defense. It should always be health behavior modifications. It should always be look at what you eat, change to a healthy diet, exercise, and of course reduce stress. Sometimes we forget to talk about stress, but stress is a major factor in these chronic conditions.
Is that right?
It is, as a major factor. Stress can raise your blood pressure, stress can cause your blood sugar levels to increase, and people need to find ways to manage stress. So sometimes we can't always avoid stressful situations, but if we find ways to manage it, then that's better.
Well, but I can dad then, like they say, because all of these things that I got to deal with, I am stressed straight out. So I need to watch myself, right?
Watch yourself. When you're feeling stressed, go for a walk, listen to some relaxing music, read a book, whatever you need to do to relax, to keep yourself calm. Don't get overly anxious, you know.
But the thing about it is, exercise reduces stress.
Absolutely.
Eating healthy reduces
Yes,
stress.
absolutely.
So all of it goes in a circle, right?
Yes.
And actually all roads lead to the same thing.
Yes.
Like, we have to do this now. It's time for everybody to just get with it, go for a walk, eat vegetables, eat fruit, just do it, because you're gonna have to do it anyway, right? You're either gonna have to do it when you're diagnosed and now you're almost on the board of you're gonna die and do it, or do you want to get off the elevator and be proactive, not even have to get to that point yet, but what point are we going to start doing it? And then the great thing is, yeah, you feel more healthy. And you know, we make so many excuses for why we can't do it. We're so busy. But when I was really looking into it, and also with my father, he's way more busy than me, and he and Bill Gates and other people like this, Richard Branson, so many people, they always make time to do it for themselves without any excuses. They take care of themselves first. And it's just like, you know, how they say in an airplane, you have to take your oxygen mask and put it on yourself first before you can help anybody else. So it doesn't help if we're gonna die, right? We're gonna die before our time to die, right? Might as well get with it and be proactive into doing it. So we just need to do it.
One of the things that we didn't talk about in any of the segments is water and drinking water, how important it is.
Staying hydrated is very important, especially now that we're in the summer months. Well, all through the year, we should be drinking lots of water, at least 8 glasses of water. It's important to stay hydrated all the time, but especially when you're exercising. You don't want to be passing out when you're exercising. That's not a good thing, so stay hydrated. Water is the beverage of choice.
8 glasses?
Yes. 8 glasses.
What about if you're only doing 2 or 3?
That's not enough.
Good.
That's not enough, because if you're only drinking 2 or 3, that means you're drinking something else. What else are you drinking? Is it the sweet beverages, the sodas, the Kool-Aid, those other drinks that's full of sugar? What else are you drinking? You know, substitute those sweetened beverages with water.
And you couldn't emphasize more how people ought to avoid sugar and salt, eh?
Absolutely. Sugar and salt, those are our weaknesses. And fat.
And fat.
We like the sweets. We like to have dessert after every meal. Everything we need, we feel like we need these sweets. And then salt. We like our food seasoned, highly seasoned. And then we like fried foods, that's fat. All of these things are what make us sick.
Now, you know, I'm just curious, because you both are so eloquent, so articulate. I am just wondering how 2 of you got involved in the same profession, working in the same ministry. Now, you got to help me here. How you got, you obviously, you were trained together?
Yes, so we both studied public health at the graduate level with a concentration in health promotion, education, and behavior.
Where was that?
At the University of South Carolina.
You can talk. Tell me, man. All right.
So in the program, it was a 2-year program. It was very involved, and what I got from it was how to engage people to changing their behaviors. And one of the things that you do is set SMART goals, S-M-A-R-T. It has to be specific, measurable, attainable, realistic, and time-bound. So say someone who just got diagnosed with a condition and they're lost, they don't know what to do. You start off with setting SMART goals with them so that they can have something to work towards. That way they're just not going blindly saying, okay, I have to eat more vegetables, but I don't know what that means. You know, you break it down to them and help them with setting exercise goals and what are you going to do differently that you're not doing now. What are you going to change? So we learned about how to engage people and how to help them change behaviors from unhealthy behaviors to healthier behaviors.
Interesting.
Yes.
Natoya
Yes.
and Nakara.
Yes, sir.
Natoya and Nakara Patterson. Again, you brought beautiful guests to us today. Very, very,
It's
very
wonderful.
nice to see you both.
Thank you so much for having us.
Come back again soon.
Yes, we will.
And put on your glasses so that you can look exactly like her. All right? Thank you so very much, Bianca.
Thank you.
We thank you so very much for watching and listening to our program. We hope that this program has been extremely helpful, especially with those people who have already been diagnosed with the disease. You heard earlier from the two nurses from Flamingo Gardens Clinic, and you heard just now from Natoya and Nakara Patterson, who have been extremely helpful. Thank you so very much, Bianca. Thank you for watching and listening to our program. Good evening, everyone.